Good afternoon, everybody. It's January 5th. Hard to believe, but we are in the new year, and this is a midweek update. You know that I usually am just doing them once a week these days, but with the surge going on of COVID-19 and the incredible volume that we're seeing across our system, I wanted to just give staff an update and the community update as to what is going on at Heywood. Today, we have 35 COVID positive patients in our system. Our lab director told us just a bit ago that we passed our 10,000th COVID positive test that we have seen in our labs alone. And as you know, our labs do an incredible amount of volume. We are running our COVID testing equipment there 22 hours a day, just to give you a sense. And we have peaked at over about 250 positives on a single day. Clearly, our ERs are crowded. We have patients waiting for beds. We are just doing our best to manage incredible volume across the system. The leadership team in the hospital, both hospitals and the medical group, meet 3 times a day via Zoom, morning, midday, and afternoon, and now 7 days a week to try to manage the patient flow. And so just please, if you know someone who works at Heywood or works in healthcare, please thank them for the yeoman's work that we're doing. We also have a high level of positivity amongst our staff, even though all of them are vaccinated. Not all are boosted, but all are vaccinated. Thankfully, most of their symptoms are mild or manageable, but obviously with staff out and 200 plus vacancies available in our system, we are working 24/7 just to make sure that we can hold it all together, and we're doing a very good job of it, and I'm incredibly proud of everyone doing the work that they're doing. But please, I just want everybody to know that everybody's working very hard. And if you are coming for us for care, please be patient, as we are doing a lot with the limited resources that we have, not to mention the supply chain crunches that we are experiencing, just like every other hospital in the Commonwealth, in New England, and across the country. Just to let you know, we need the community to understand when to come to the ER for care and when to go to urgent care and when to call your primary care physician. You know, you need to come to the ER not for a COVID test. Please don't come to the ER for COVID tests, because that's just an inappropriate place to get it. You go to our urgent cares for that, or you call and make an appointment for our testing that is available 7 days a week on our campus. But if you don't have any symptoms, please don't come get a COVID test, because that just, wastes resources, number one, and number two, compiles the amount of work that we need to do. If you're asymptomatic, have no symptoms, see if you can get a rapid test if that's something that you want to do. But just make sure that you are getting the right care in the right place, utilizing your primary care physician. If you don't have a primary care physician, you can go on our website, click on get the number, and we will get you hooked up with a primary care physician. There's just a little note here. You might have seen it on Facebook or other social media, just to make sure that you're using our ERs appropriately for the care that you need. Obviously, if you think you have COVID-19, you're having trouble breathing, you have persistent chest pain, pressure, confusion, inability to wake or stay awake, you've got pale gray or blue colored skin, lips, or nail beds, obviously you need to get the care you need from us, and we encourage you to come in and make sure that you come in, and we will triage you and we'll take care of you as best as possible. But if you really should be going to an urgent care for less severe things, that's the place to go. But if you have a true emergency, obviously you need to come to the hospital, and we'll take exceptional care for you, and just managing our beds as we can. So there's some information here on symptoms that you can take a look at and make sure that you are up to date on the latest Omicron symptoms as well, and just make sure that you utilize our system in an appropriate manner so that we can take the best care of you in the right venue. Obviously, if you showed up someplace like a primary care and you need to be admitted or whatnot, we will take care of that. We'll get that through. Same with the urgent care as well. But just to make sure that everybody understands the strain that we are under, and we want to do the best job we can to take care of our community, and appreciate you getting that word out and making sure that we are using our resources as best we can in our small community hospitals, in our semi-rural region of the state. There are no ICU beds or almost no ICU beds in the Commonwealth across New England. And so we are working very hard to make sure that we have the bed capacity. We are still waiting to put patients in beds as we speak. We probably won't get that done till 11 o'clock tonight. We may not actually have beds, and we'll have to hold people in ER or other venues just to make sure that we can take care of everyone. So just a quick update for everybody. I'll be back on Friday with a much longer update and give you information that you need to get through the weekend and manage your health. Thank you and take care.